Doesn't I've changed this one into Excel, but I mean PowerPoint, but when I want to copy to go.
Good morning, good afternoon, good evening, dear colleagues. Thank you for joining us. It's a pleasure to have you here. We'll just give it maybe 1 to 2 more minutes for others to join. Thanks a lot. Okay, I see 85 participants have joined. We're thrilled to have you here. Thanks again for taking the time. We'll go ahead and make a start. This webinar is being recorded, so we will also be able to share this for others who aren't able to be here with us today. I will just introduce this webinar and pass it off to our lovely list of speakers. And I'll be your moderator today. So my name is Sarah Hollis. I'm an epidemiologist at the World Health Organization Regional Office for Afro. I am based in Nairobi, Kenya, and I'm the team lead of the Health Information and Risk Assessment Unit. Today, we have an exciting virtual workshop where we will be talking about the Integrated Disease Surveillance and Response Strategy and Framework, going through its current status and strategies for improvement. I will just be taking you through different participants that will come on board and do housekeeping, opening remarks, objectives, etc. So I'll be here with you as a moderator. Just as a reminder to all, please put your name and where you're from in the chat, and we really look forward to seeing who is joining us today. Without further ado, I will pass it over to Mildred Chirwa, who will go over the housekeeping. Mildred is an M&E specialist in our Dakar hub. Over to you, Mildred. Many thanks.
Thank you, Sarah, and welcome, colleagues. Thank you all for joining. So I'll just share this slide for housekeeping. Okay. I hope you can see my slides. Okay, so welcome to today's webinar. So the webinar is on IDSR implementation in member states, the current status and the strategies for improvement. So the webinar is for 1 hour and a half Brazzaville time. So before we start, we should adhere to some of the code of conduct. So that one includes avoiding interruption. So if you want to add any comment or concern, you have to raise your hand and then proceed. And also we have to prevent and respond, we have to avoid sexual misconduct or any language around this topic. So basically just no more respect for the panelists and also the attendees. So just before you start, just check your microphone is working and the camera is working, more especially for our panelists and also for the attendees. You can raise your hand on that icon there if you have something to say. So there's also question and answer, a place there where you can log in your questions and concerns that you have. So you can also put, as I said, your questions in the question and answer, and also your interpretations. So we are going to have interpretations in Portuguese, French. So some of the panelists will be speaking in English, some in French, but we have those interpretations. So you can also switch on your laptop to get the interpretations.
Sorry to interrupt you, Mildred. I know that your slides are not being shared and people are commenting in the Q&A. Over to you in case you are able to display your slide. Otherwise, we can just wrap up very soon. Thank you.
Okay, all right. Okay, so that's where your captions will appear. You can choose to hide them or not. Yeah, but we also have to record this discussion, the materials and feedback. Some of the links will be shared in the chat, so just be mindful. So generally, that's our agenda. So we have 4 key speakers. That's Dr. Etienne, Dr. Paul Sabiu Frey, and Dr. Emmanuel, and of course there's Sarah and myself. So I'll stop here on the housekeeping. I'll give it back to Sarah. Over to you. Thank you.
Thank you, Mildred, and welcome again, colleagues. We're aware that the chat has been disabled for some participants, so please, no worries if you can't introduce yourself then. We're very happy to have you in attendance, and we have your registration details. So welcome again to the now 137 colleagues that are on the line from various countries and member states. So just another reminder for the Q&A functionality, if you can please limit the Q&A to your questions that you have on the technical content as we go along. And as Mildred mentioned, we will revisit that at the end of the session so that we can have some dialogue. We will next go to the opening remarks. We're very happy to have our program area manager for the Regional Office for Africa Health Information Risk Assessment, Dr. Etienne Kua. I will pass the floor to Dr. Kua to give his opening remarks. Over to you, Dr. Etienne.
Thank you very much, Sarah, and welcome to everyone. Good morning. It's exciting to have you all at this very important webinar on this critical subject of IDSR implementation in member states to look at the current status and the strategies for improvement. It's been a long time since we had the last IDSR and TAS, which is the Transforming African Surveillance System webinar. So it's really a perfect opportunity to discuss our collaborative work on IDSR implementation. On behalf of Dr. Abdul Salam Gay, the Regional Emergency Director at WHO Afro, I would like to warmly welcome you to this IDSR webinar. I also bring greetings from our Regional Director at Afro, Dr. Chikwe. So back in 2022 and also 2023, we reviewed the impact of COVID-19 on the implementation of IDSR, including how several core functions of IDSR and activities were disrupted, including reporting, adaptation of technical guidelines, planning, but also training and supervision activities. We all together started some activities to collaboratively understand the challenges and develop work plans. So as you remember, back in 2022, in May, we had we launched the Transforming African Surveillance System, which is really primarily designed to reimagine the IDSR systems and structures.
Dr. Etienne, I'm so sorry to interrupt. Do you have slides that you're projecting? If so, we cannot see
No,
them.
this is not this slide.
Okay.
So WHO also convened the first IDSR webinar back in May, as I mentioned, to review the current challenges and also reflect on solutions. We hosted 3 regional workshops, one in Abidjan, one in Kigali, and another one in Johannesburg, to start developing work plans to address those challenges. We also altogether conducted several surveys, and today's webinar will actually explore the results of the latest survey conducted in 2024 and how we can think of new ideas to improve IDSR implementation. The implementation of IDSR and task acceleration in the past 3 years has clearly demonstrated that African surveillance can work effectively. But while progress is being made, a lot remains to be done. So addressing those gaps in a systematic manner should remain our focus. collectively to enable quicker detection and to improve response to the public health emergencies in our region. So as we have all embarked on building a stronger IDSR and epidemic intelligence systems across the countries, we really focusing on how we can improve and integrate facility-based surveillance, event-based surveillance, community-based surveillance, laboratory, and One Health approaches and their use at country level. We also acknowledge the huge potential and need to harness new technologies to modernize and improve disease surveillance in Africa. So I would like to urge you to come up with tangible actions and way forward in strengthening IDSR during this webinar. Importantly, we need to embark on mobilizing domestic and external resources for long-term sustainability, a very important aspect of our work around IDSR. So I thank you all for joining this webinar and the discussions on new approaches to improve early detection. I would like to welcome you once again and wish you a fruitful deliberations and during this workshop. Thank you very much.
Thank you, Dr. Etienne, for those opening remarks and for reminding us of the overall big picture and what we're working towards together under your leadership in the region. I will now pass it over to Dr. Paul Ouma to take us through the objectives and expected outcomes of this webinar. Dr. Ouma is the team lead in the Dakar Hub, my counterpart in the Dakar Hub for the Health Information Risk Assessment area of work. Over to you, Paul. Thanks.
Thank you, Sarah, and I hope my slides are visible.
Perfect, we can see that.
Yes, so thank you very much, Sarah, and good morning to colleagues. So I will take you through the objectives of this webinar, which we intend to look at the implementation in countries, the current status, and strategies for improvement. So for this session, we will go through the objectives, and also after that, I'll also provide a brief overview of the expected outcomes. So for this webinar, our main goal is to update countries, you participants who are here, on the regional strategy on the integrated disease surveillance and response, that is the IDSR strategy between 2020 and 2030. And so this discussion has three main points that we intend to cover. The first one is on the current status, and this is based on the 2023 survey that Dr. Etienne has already referred to. We will also look at the gaps in IDSR implementation and some of the innovative approaches. And this will mainly be useful in terms of identifying the challenges and some of the potential solutions that can address those challenges. We will also do an introduction of the 2024 survey, what it intends to do, the process, and the next steps in terms of filling out the survey. And throughout this process, we hope that we will have an interactive session in terms of understanding the objectives and what is expected. And so by the end of the webinar today, what are the expected outcomes? Mainly, we expect that countries will have been updated on the current status of IDSR implementation and how this aligns to the regional strategy and the specific milestones. Secondly, we also expect that countries will be informed in terms of the gaps in IDSR implementation, but we'll also take this opportunity to introduce the innovative approaches for improving our IDSR implementation in countries. And then lastly, is that countries will understand who, how, and when to complete the survey, and to also track the progress towards the regional strategy milestones. That's it for me, and thank you. Over back to you, Sam.
Thank you so much, Paul, for taking us through what we should be thinking of throughout the next hour or so. We will now be getting into the meat of the discussion. So before passing over to Dr. Saliou, I will just remind people that are joining us, we have almost 200 participants on the line now. If you could just put your questions that you have in the Q&A function instead of in the chat so that we can better monitor it. It's really great to see where everyone is signing in from, and thanks for all of your introductions in the chat. I will now pass it over to Dr. Saliou. Dr. Saliou is an epidemiologist focusing on surveillance and disease modeling. He is working at the Regional Office for Africa in our Dakar hub, in our emergency hub based in Dakar, Senegal. Over to you, Dr. Saliou, to take us through the 2023 assessment. And just as a reminder, Dr. Saliou is presenting in French, and so do take note of
very much. Yes.
Sorry, go ahead.
Can you hear me and see my slides?
We can see your slides, and I was just taking note for colleagues to use the translation functionality as you'll be presenting in French.
Yes, thank you very much. So my name is Dr. Saliou Diallo. I'm an epidemiologist and disease modeling specialist working with WHO APRO. I'm based in Dakar. For this session, I will speak in French. So please, colleagues, if you can switch to the translation. Donc, rebonjour, chers collègues. Je vais vous parler très rapidement donc, de la mise en œuvre de la stratégie régionale de la SIMR dans les États membres de l'Afrique. Quelle est la situation actuelle et quelles sont les progressions que nous avons actuellement vers l'atteinte des cibles. Pour cette présentation, nous allons aborder 4 parties. La première partie, c'est une introduction globale sur la stratégie régionale de la SIMR. Nous allons aborder les méthodes que nous avons utilisées pour pouvoir réaliser ces enquêtes auprès des États membres. Nous allons aborder quelques principaux résultats qui ont été obtenus, notamment en 2022 et en 2023. Et nous allons terminer par une conclusion et des recommandations. Donc, en guise d'introduction, comme vous le savez, la stratégie SIMR a été adoptée en 1998 et 20 ans après, il était nécessaire de se réunir et de développer une nouvelle stratégie pour améliorer l'implémentation de la SIMR dans les différents pays. Donc, cette stratégie régionale couvre la période 2020-2030. Et son objectif, c'est de réduire la morbidité, la mortalité, l'invalidité, ainsi que les pertes socio-économiques qui sont dues aux épidémies et autres urgences de santé publique en Afrique. Il faut noter que 2 dates sont à retenir pour pouvoir traquer les progrès qui sont réalisés. Donc, la première date, c'est en 2024. C'est pour ça que ce webinaire est le bienvenu pour pouvoir discuter avec vous, introduire l'enquête qui est extrêmement importante parce qu'il y a 2 dates, comme je l'ai dit. En 2024, on va évaluer l'évolution vers l'atteinte des cibles et en 2030, on va évaluer est-ce que ces cibles ont réellement été atteintes. Alors, 4 objectifs spécifiques de cette stratégie régionale. Le premier objectif spécifique, c'est le renforcement de la détection précoce. Dr. Etienne en a parlé. Donc, la détection précoce, la notification et le rapportage ainsi que l'analyse des données, c'est le premier objectif spécifique. Et pour ce faire, il y a un certain nombre de cibles ou d'indicateurs qui ont été définis, notamment la mobilisation des ressources financières, la mise en œuvre de systèmes, que ce soit la surveillance basée sur les indicateurs, la surveillance basée sur les événements et la surveillance à base communautaire. Il y a aussi la détection des événements aigus de santé publique et leur signalement dans un bref délai. Il y a la publication régulière des bulletins SIMR. Il y a l'analyse des données. Il y a la capacitation des personnels de santé, donc leur disponibilisation dans les structures sanitaires. Mais aussi, il y a la mise en place d'un SIMR électronique qui est fonctionnel dans 90%. Le deuxième objectif spécifique, c'est de renforcer les capacités de laboratoire. Et pour ce faire, il y a un certain nombre de cibles et d'indicateurs qui ont été aussi définis. Notamment, le premier, c'est que les États membres disposent d'un système de laboratoire qui soit capable de manière fiable de réaliser les tests de base dans 80% des districts. Le second, c'est la détection des événements aigus de santé publique et leur notification rapide, bien évidemment, leur confirmation à laboratoire en fonction des directives et des normes nationales et internationales. Et enfin, pour ce deuxième objectif spécifique, c'est la disposition de normes nationales de qualité pour les laboratoires qui est extrêmement important pour être sûr que les résultats qui sont donnés sont des résultats de qualité. Le troisième objectif spécifique, c'est de renforcer les capacités de préparation et de réponse aux urgences de santé publique, et ça à tous les niveaux. Donc, cela inclut notamment l'évaluation nationale des risques qui sont liés aux situations d'urgence. Il y a aussi le fait de disposer d'un mécanisme de coordination des interventions d'urgence. Il y a le fait de disposer d'un centre national d'opération d'urgence qui soit fonctionnel, et aussi de tester les systèmes d'intervention d'urgence avant que l'urgence ne soit déclarée. Et enfin, c'est de disposer d'équipes d'intervention rapide multidisciplinaires, que ce soit au niveau national ou bien au niveau infranational. Et le quatrième et dernier objectif spécifique de cette stratégie régionale, c'est le renforcement du système de suivi, évaluation et de supervision. Donc, c'est là, il était prévu que chaque année, les performances de la SIMR soient réalisées à tous les niveaux, que les États membres fournissent des rapports trimestriels sur les indicateurs clés de performance. Cela permet de traquer le progrès vers l'atteinte des cibles, et aussi la capacité, tester les capacités notamment du RSI. Alors, quelques principes directeurs pour pouvoir mettre en place cette stratégie, c'est notamment l'appropriation nationale. Donc, le renforcement de la SIMR, c'est d'abord la responsabilité du gouvernement au niveau national, avec le soutien financier et technique de l'OMS et des différents partenaires. Il faut aussi une collaboration intersectorielle, selon l'approche Universelle Santé. Il faut une implication de la communauté. Donc, c'est très difficile de mettre en place et à l'échelle la SIMR sans une participation active de la communauté. Donc, la mise en œuvre de la SIMR, comme vous le savez, se fait au niveau des établissements de santé et avec la participation de la communauté. En termes de financement aussi, c'est extrêmement important pour assurer la durabilité du système, le suivi et la responsabilisation, et enfin l'intégration de la dimension genre et équité. Donc, les données SIMR devraient normalement être ventilées au moins par âge et par sexe pour avoir la dimension genre et l'équité. Alors, donc, afin de mesurer les progrès qui sont réalisés vers l'atteinte des cibles, nous avons jugé nécessaire chaque année de réaliser, d'évaluer l'état de mise en œuvre de la SIMR dans la région. Donc, à travers la mise à jour des informations sur les systèmes et les structures, mais aussi à évaluer le niveau d'atteinte des cibles. La méthode, vous la connaissez, c'est une méthode mixte, quantitative et qualitative. Elle est principalement axée sur la stratégie régionale, mais bien évidemment, il y a d'autres questions, comme vous le verrez tout de suite là. Donc, il y a un questionnaire qui est structuré et qui est en ligne et qui est partagé aux différents États membres à travers, grosso modo, 6 sous-sections. C'est la mise en œuvre de la stratégie SIMR, la planification et le financement, le rapportage des données, l'évaluation du système, le suivi des performances et le système de laboratoire. Alors, quels sont les résultats qui ont été obtenus? Premièrement, en ce qui concerne la mobilisation de 80% des ressources financières qui sont nécessaires à la SIMR, des progrès ont été réalisés. On part de 5 États membres qui avaient fait cette mobilisation en 2022 à 29 États membres qui ont parvenu à le faire en 2023. Il y a eu du progrès, mais il y a encore le pourcentage d'achèvement est de 62%, donc il y a encore du chemin à faire. Et l'objectif, c'est qu'en 2024, en fin 2024, décembre 2024 qui vient de passer là, que tous les États aient pu mobiliser les 80% de ressources financières nécessaires à la SIMR. Le second, c'est la mise en œuvre de la ICMR, la surveillance basée sur les indicateurs, la surveillance basée sur les événements, la surveillance à base communautaire, avec une couverture nationale de plus de 90%. Sur ce point, il y a encore beaucoup de progrès à réaliser. Puisque, comme vous pouvez le voir ici, on est passé de 13 États membres à seulement 17 en 2023, avec un pourcentage d'achèvement de 36%. Donc, on le sait tous, la surveillance à base communautaire, c'est là où beaucoup d'efforts doivent être réalisés pour pouvoir impliquer la communauté, collecter les informations à partir de la communauté, les inclure dans la SIMR. Je vais le répéter ici, la SIMR, ce n'est pas que la surveillance basée sur les indicateurs. Ça inclut celle basée sur les événements et la surveillance à base communautaire. Donc, le troisième indicateur, c'est le pourcentage d'événements qui ont été détectés et signalés dans les 48 heures suivant leur détection. Là aussi, il y a eu des progrès. On est passé de 17% en 2022 à 43% en 2023, sachant que la cible, elle est de 80% pour la fin de l'année 2024. L'autre indicateur, c'est la publication d'un bulletin hebdomadaire. Là aussi, on est passé de 35 États membres en 2022 à 39. Et la cible, c'est que tous les États membres puissent publier un bulletin relatif à la mise en œuvre de la SIMR dans les différents pays. L'indicateur suivant, c'est l'analyse. Donc, le fait de faire une analyse de base des indicateurs qui sont contenus dans la SIMR. Là, il y a eu des progrès. L'objectif était que 47 pays puissent intégrer l'analyse basique des données. Cela est fait, mais il faut encore aller plus loin. L'analyse basique ne suffit pas. Il faut faire une analyse beaucoup plus poussée pour que les décisions de santé publique soient fondées sur des évidences. L'indicateur qui suit, c'est le personnel de santé, donc la formation du personnel et leur disponibilisation au niveau des structures sanitaires. Là aussi, il y a eu beaucoup de progrès, donc on a atteint les plus de 100% de cible, mais c'est parce que la cible, elle était de 30%. Donc, on est passé de 23% en 2022 à 66% en 2023. Je pense que c'est le lieu de souligner d'ailleurs, la plupart des pays ont réalisé les formations en cascade, que ce soit au niveau régional, au niveau district, au niveau des structures de santé, pour capaciter le personnel dans l'utilisation de la SIMR, la définition des cas, le rapportage, l'utilisation du DHS2, notamment pour pouvoir transmettre les données. Mais on a du personnel. Il faut régulièrement refaire ces formations-là pour être sûr qu'à chaque fois, le personnel qui est en place a les capacités nécessaires de faire le travail qui est demandé. L'autre indicateur, c'est l'utilisation de la SIMR électronique avec une couverture nationale de plus de 90%. Là aussi, il y a eu des progrès. Donc, on est à 68% d'atteindre l'objectif et il y a encore des progrès à réaliser dans ce sens. Et c'est extrêmement important, cette SIMR électronique, parce que c'est elle qui va faciliter la collecte des données de la communauté vers le niveau central en un temps record. L'autre indicateur, c'est le laboratoire. Donc, le système de laboratoire national qui soit capable d'effectuer de manière fiable au moins 5 des 10 tests de base dans plus de 80% des districts. Là aussi, il faut noter l'investissement énorme des équipes de laboratoire, que ce soit en formation, que ce soit en renforcement des capacités au niveau local, que ce soit la mise en place des infrastructures de laboratoire pour pouvoir détecter et confirmer. Il y a eu vraiment beaucoup de progrès là-dessus. Mais il y a encore des progrès à réaliser. Parmi ces progrès, c'est notamment la confirmation très, très rapide en un temps record. On est passé de 30% à 41% en 2023. L'objectif, c'est d'atteindre 80% en fin 2024. Donc, la confirmation très rapide, elle est extrêmement importante parce que des urgences de santé publique comme Ebola, comme Lassa, comme Marburg, si on ne les confirme pas à temps, ça va se propager avant qu'on ait pris les premières mesures de riposte. L'autre indicateur, c'est la norme nationale de qualité de laboratoire et un système d'autorisation obligatoire. Là aussi, il y a eu des progrès. On est passé de 7 en 2022 à 31 États membres en 2023. Et l'objectif, c'est vraiment d'atteindre ça. C'est quelque chose qui est extrêmement important, des normes de qualité qui soient non seulement disponibilisées dans les guides et appliquées dans les différents laboratoires. Ça, c'est un objectif pour tous les pays. Tous les pays devraient être en mesure de faire ça de façon régulière. Il y a aussi l'examen des performances de la SIMR qui sont passés, l'examen annuel, passé de 6 à 20, donc avec une progression de 43%. Et l'objectif là aussi, c'est que tous les États membres puissent le faire de façon régulière. C'est extrêmement important. On a appuyé quelques pays tout récemment dans ce sens-là, où l'objectif n'est pas forcément d'évaluer tout le système. On peut se focaliser sur un certain nombre de maladies prioritaires, parmi les maladies prioritaires, un certain nombre de districts pour pouvoir réaliser cela. Et cela nécessite bien évidemment un financement. C'est pour ça que beaucoup d'États membres n'ont pas pu aussi le réaliser. Et il y a aussi la fourniture des rapports trimestriels sur les indicateurs. Là aussi, on est passé de 0 en 2022 à 21 en 2023. Et l'objectif, c'est d'atteindre tous les 47 États membres qui puissent fournir régulièrement des rapports sur les indicateurs clés de performance, parce que sans cela, ça va être très difficile de savoir est-ce qu'on est sur la bonne trajectoire pour atteindre les cibles qui sont définies en 2030. Alors, ces gaps qui ont été identifiés ici, nous allons avoir tout de suite une session qui va parler en détail des différents gaps qui ont été identifiés et surtout des stratégies d'innovation pour pouvoir combler cela. Comme vous le voyez ici, il y a encore du chemin à faire, mais heureusement, il y a des opportunités. Il y a des initiatives qui ont été mises en place, qui ont permis d'obtenir ces résultats. Il y a des outils qui sont mis en place pour pouvoir améliorer encore les indicateurs que nous avons ici. Et de ça, nous allons en parler tout de suite là. Donc, en guise de conclusion ici, nous pouvons dire qu'il y a une existence des structures et de systèmes. Même si au niveau de maturité, cela varie d'un pays à un autre, il y a des lacunes qui sont identifiées à plusieurs niveaux, notamment l'insuffisance des ressources financières et la mise en œuvre, j'insiste là-dessus, de la surveillance à base communautaire. Et des efforts considérables, bien évidemment, sont nécessaires pour pouvoir combler ces lacunes. En termes de recommandations, c'est notamment d'accélérer la mise en œuvre des activités sur la surveillance à base communautaire en se concentrant sur les interventions à fort impact qui sont fondées sur une hiérarchisation rigoureuse et conformément aux cibles. Il y a aussi le fait de renforcer la supervision, le suivi et évaluation des systèmes et d'utiliser ces informations qui en résultent pour pouvoir améliorer le système. C'est une boucle. Il faut à chaque fois superviser, évaluer ce qui est fait, formuler des recommandations pour que le système soit amélioré. On ne va pas atteindre un niveau de performance de 100% une seule fois et dire là, c'est bon, c'est fini, ce n'est plus la peine de continuer. Donc, en permanence, on sera obligé d'ajuster les stratégies qui sont mises en place pour pouvoir encore améliorer le système. Et en 2030, c'est une nouvelle stratégie régionale qui va être mise en place et qui va définir d'autres cibles encore pour pouvoir améliorer mieux. Et enfin, il faut renforcer le plaidoyer auprès des institutions nationales d'abord, qui sont responsables de l'affectation des fonds afin de garantir un financement durable. Sans un financement durable au niveau local, on voit actuellement avec le désintérêt de certains financements qui sont obtenus de l'extérieur, c'est extrêmement important de mobiliser les ressources internes pour que la SIMR puisse fonctionner. Parce qu'au-delà d'être une stratégie régionale, c'est d'abord au niveau local de détecter les événements de santé publique et d'y faire face rapidement pour réduire l'impact que cela peut avoir au niveau de la population afin d'avoir une sécurité sanitaire adéquate. Je vous remercie pour votre attention.
Merci beaucoup, Salur. C'était très intéressant et félicitations pour tous les pays pour le bon travail. I will just remind everyone, because we note that there's been some questions in the chat for the interpretation. So in order to access the interpretation, there's a button on the Zoom that says More, and you can click and see interpretation. It's a globe. So click on the globe icon and you can navigate to French, English, or Portuguese. Our next presenter will be back in English. So we do hope that this is easier for some. And also to address the questions, we will absolutely send the PowerPoint slides in English as well as French after the presentation so that everyone can access. Okay, we will move along to the next session where Dr. Etienne will be covering the gaps in IDSR implementation and innovative approaches that we can all take collectively. Over to you, Dr. Etienne.
Thank you very much, Sarah. I hope you all hear me clearly.
Yes, go ahead.
Perfect. So we will switch from French to English. I hope you can catch up with the interpretation button. The idea of these slides is a little high level. It's not really to show all the possible ways of resolving the issues. It is rather what we have found, a summary, and how yourself and ourselves, we contributed to some of the ideas for improvement. And then, of course, today, we hope that during the discussions, you'll have more suggestions that can be taken into account to address the challenges. So the gaps, really, we did a lot of work around the gaps altogether and some of the approaches. So this is what this presentation will be about. Now, back in, I have actually said that during my introduction, my welcome message, we started with what we call the Transforming African Surveillance System, which is to really put focus on how we can use technology to improve IDSR implementation. So what you have here is back in 2022, we had a regional webinar with almost 800 people connected from ministries of health and other sector ministries, country offices, which was very important to understand and discuss really some of the quick challenges that we can address. So the Transforming African Surveillance System has become a way to address the challenges that we all discussed. We were also conducted in 2022, right after the survey. We conducted a survey right after the webinar. We conducted a survey in 2022 that, with your input, of course, which really helped understand many, many questions. And the report came out, which was shared with all of you to see clearly where are our challenges, which areas we should focus on. And then we also went together on conducting some workshops, free regional workshops, which basically covered all the member states by sub-region. I had also mentioned that previously. And those workshops really helped understand how the ideas that you had to address the challenges. And some the work plans were developed, at least drafted, which were addressing key areas that can be resolved in terms of addressing the challenges. Now, so this is really to show you and to congratulate everyone, actually, because we made a lot of progress from the time we had those discussions to today. As you can see here on your left, today, in terms of reporting, just for the other week, we have 38 countries that reported IDSR data to Afro. We are now, so 81% of completeness. and 62% of timeliness. Overall, since the beginning of the year, we have 91% completeness and 53% timeliness. 32 countries are using the IDSR centralized platform, which is really helping, and I'll say a few things about it later. And then we could easily see challenges, countries that have more challenges, and how we can address. So we had developed ways to address challenges in Equatorial Guinea, in Mauritius, in Comoros, for example, with technical assistance on the ground, which really helped address the clear big challenges that the countries were facing. And of course, many countries have been going through the task implementation, discussing very details with the team here, and that really helped. So we have to remind ourselves that when we started back in May, so which was really post-COVID, May 22, the reporting level was very low. And I think you all remember this red slide that I showed back in 2022, which later, with very simple ideas that we discussed during the webinar, was really getting the process improved. So 2 years later, back in June, for example, we had a better picture. So you can see that we have more green. Green means that countries have reported on time. Yellow means that they reported but late. And red means that the report did not come in. So this really helped address, some of the countries that I have just mentioned, because we know clearly where the threats are, and we could focus. Now, in terms of summarizing what we have all found out as we went through the surveys, the regional workshops, the webinars to discuss, these are, I would say this is really a good summary of what we found. The financing for surveillance is a big issue. In many countries, there is no line budget for surveillance, to even think of IDSR specifically. In training, so training coverage is still critical. The geographic coverage as well. So in many places, the coverage may be in a couple of districts, not all. So the subnational levels is really critical actually to this work, and that needs to be addressed. And then one thing that came across many of the talks that we had was the electronic tools to support the process of data collection with transmission and analytics. We now recognize that it's a very heavy process. Reporting data every week on priority diseases throughout all the country is really heavy. And doing that by, manually is almost, I would say, almost impossible, to say the truth. And so we all recognized during the first webinar that one thing to start addressing was to really have the digital tools as a game changer, basically. The capacity to use the data. So even if you have a data, how much are you using it? And really, do we have that culture quickly to know that, we have to refer to our data quickly to understand what is going on before things actually happen? So that culture. And then the leadership, of course, that is needed to position surveillance as a priority is also key, and laboratory capacity for confirmation, for diagnosis, and so on. The integration of, several components of surveillance, with community-based, event-based surveillance. IDSR tend to have more, at least in many countries, with more focus on indicator-based surveillance, where many things that we find out are starting in the community. And so before you get to facility, we have a lot of issues and cases that have already spread. The reporting, of course, as you saw in previous slide, is a challenge, and then also data sharing. Basically, reporting is one thing, but sharing the data, even within the country, across the districts, to really understand the challenges, what we are seeing on the ground is important. And then finally, as we implement IDSR, it was also identified as a priority gap is to really do regularly performance evaluations and reviews to understand where we are and how we can improve. So this is just to summarize that. As we speak, we think we know more or less what is going on through many of the surveys that we have mentioned, the task implementation progress reports, we have quarterly reports of IDSR. So those are really contributing to understand where the challenges are and how we can address them. And so here in the middle, what you have is really, I would say, a summary of everything. So how do we scale up training at subnational level and have a better geographic coverage? With the training tools that we talked about, the laboratory capacity, the performance reviews, the integration, the financing, and then, of course, the leadership that is needed to have all of this into priority as a priority to really get things moving. And so based on that, we have kind of identified the priority interventions. Basically, we know that if we're scaling up IDSR, which is really more on the training with TOTs, the cascade training that are needed, we will be able to have a better geographic coverage. The data management analytics that is needed, the diagnosis and genomic sequencing capacity that goes with it, and then also the monitoring and evaluation, and then finally the advocacy and coordination work. One thing, as I mentioned, is which you all came up with is to use technology to improve the process. So digital tools to improve the process. So basically, how much we can use data to collect data to collect the points at the say facility level of the communities using tablets, mobile phones, anything that we can boost our data collection. The centralized IDSR was a suggestion during the first webinar to really have a platform for our member states to submit the data to Afro, but also to have analytics that go with it. So we've been able to actually put that in place. And as I mentioned, 32 countries are already using the platform. We encourage other countries to use the DHISO platform, which has a lot of analytics. So you can easily see where you are in terms of alert threshold at a district level, for example. Pretty much drafting your weekly bulletin automatically. You can input later to personalize it, to have it clearly done. Situational reports, and also focusing on the use of the data, as I mentioned much earlier. And so these are now available, and we really encourage member states to use it. For example, one of the tools, the analytics tools that has been quite useful for member states is to have that surveillance dashboard, which we call the threshold dashboard. Basically, as you import your Excel sheets every week, automatically you will see where your threshold has been crossed, which will be showing red. But also, we don't wait until you get to the alert level. When it's close to the threshold, you will have yellow that tells you, well, in this district, we'll have some issues. So you can zoom in and see which disease or which condition the data is talking about. And then finally, as we go, and of course we welcome many of the ideas today, is that IDSR alone will not solve all of our problems. We have to think of integration. So the innovation that is needed is really how do we integrate many sources of data to be able to accelerate our detection. For example, the media monitoring you are doing on the ground, which we have all made quite some progress. How do we get the signals? How do we cross-check with our IDSR data? And how do we also track the events that are ongoing once they are confirmed, so we can better monitor our events on the ground. Yeah, so I will stop here. So the idea was really to give you a raw summary, and then the discussions should focus on how we can move forward. Thank you very much.
Thank you, Dr. Etienne. Very interesting and super ideas about how we can all improve the IDSR adherence. So just noting on time, we're running a few minutes behind and we want to make sure we have time for questions and answers. So for the next session, Emmanuel and Fleury, I'll actually shorten your session just by 5 to 7 minutes. Also, we've gotten some great questions in the chat, which we will address during the live question and answer session, but please don't hesitate to write additional questions there, and we'll see how we can triage them in the live session. Okay, we will move right along to our next session, which is on introducing the 2024 IDSR Implementation Survey Questionnaire. I will pass it over to Dr. Emmanuel Zotzi, who is a consultant at the regional office. He's based in Brazzaville, and he's supporting IDSR implementation. Over to you, Dr. Emmanuel.
Thank you very much, Sarah. Please, can you see my presentation, the slide? And can you hear me? Can you see the slides?
Yes, we can see you, we can hear you. Thank you very much. We can see your slides.
Yeah, so in the next few minutes, myself, Dr. Imarujochi, and Fleury will be talking on the introduction to the 2024 IDSR Implementation Survey Questionnaire. So straight away moved into the introduction and objectives of the survey, the methods, and then lastly, we look at the questionnaire. So as a form of introduction, as presented and required by the regional strategy, the progress in implementing IDSR by member states will be tracked annually. So when we perform performance monitoring, it helps us to continuous improvements. It helps us to support planning and resource mobilization, and also support decision-making and optimize resource allocation. The general objective of this survey is to ensure that the implementation of IDSR runs smoothly and contributes to achieving the set objectives. The specific objectives are: 1, to update the general information on IDSR structures in member states. 2, to assess the level of achievement of milestones and targets as prescribed by the regional strategy. And it also, lastly, assess the performance of core and support functions of IDSR. So what method are we going to use? It's a cross-sectional survey targeting 47 member states, using both quantitative and qualitative methods. This survey will focus on the IDSR core and support functions, and also what is stated in the regional strategy for IDSR 2020-2030. It will be a structured online questionnaire using the Kubo Collects. The questionnaire has these sections: the section on identify disease conditions and events, reporting diseases, conditions, and events, data analysis and interpretation, investigation and confirmation of suspected outbreaks, preparing for outbreaks and other public health events, responding, providing feedback, and then the area covers the capacity and building and financing for IDSR, monitoring and supervision. So we will review the data and then conduct the analysis using SL and R software. These are the suggested time frame. Of course, we'll receive any feedback from you. So we hope to start this survey early this March and then end in April 2025. So as we are doing now, we are introducing you to the tool, that's a questionnaire. And then we hope that when we receive and then integrate all the feedbacks, we'll start the data collection from member states by the 17th of March. And then we'll do follow-up reminders, and hopefully by 24th of March 2025, we'll end the data collection and start data cleaning and review. We'll request for any clarifications or confirmation of the information that we received. And hopefully, by 31st of March, we'll end the data cleaning and review and start the data analysis and report writing. We'll also be requesting for additional information, and hopefully by 14th April 2025, we'll end the data analysis and report writing. We will review and validate the information we collected on the 21st of April 2025. And by 30th of April, we will disseminate the results. So now let's proceed and look at the questionnaire. So I'll be projecting the questionnaire. Please, can you see the questionnaire?
Yes, we can see it.
So the questionnaire is an annual assessment of IDSR implementation in the WHO African region. I may not be able to go through all the questions, but the questions, as already stated, it focuses on the core and support functions of IDSR, and then also the regional strategy for 2020-2030. So, who are the respondents? This questionnaire should be administered to the head of disease surveillance unit and his or her team at the national level. It is recommended that the team reads through the questions and gather all necessary information before attempting to complete their online questionnaire. This will help minimize any errors that may be committed when answering the question. If you have any problem with answering the questions or any clarification, please, the emails stated below, kindly send your concerns for a quick response. So the section 1 of the questionnaire is purely identification. Please, you take your time and fill in appropriately. Section 2 looks at identifying disease conditions and events. So there are some few of the questions that I'll go through and move to the second question. Question 8 is looking at how many districts have IDSR guidelines to identify cases. Question 9 is the country implementing indicator-based surveillance. So below, the definitions are given per each of the surveillance approaches. So it will look at the indicator-based surveillance, look at the event-based surveillance, and then also community-based surveillance. So the questionnaire is trying to find out whether there's implementation of these surveillance approaches in your country. And then also looking at the logbook, are these events that are captured in the district level, are they logged in the logbook of alerts? And then we also want to look at the validation, whether data validation system exists. And then question 18 and 19, it tries to focus on the bottlenecks. When you want to identify a case in your district, in your country, what bottlenecks do we face? And then also question 19 try to indicate what are the positive factors that help you in identifying cases. Section 3 looks at reporting disease condition and events. So question 20 says how many health facilities have submitted IDSR reports on time to the district. So these questions will elaborate on how completeness and timeliness rates are being captured in your country. And then looking at question 24, it specified what was the proportion of disease targeted for elimination, eradication, and any disease selected for case-based surveillance have been reported with case-based forms or line lists. And as for the previous sessions, question 25 and 26 is trying to elicit the bottlenecks that you face in reporting, and then also what are the positive factors that help you in reporting. Section 4, data analysis and interpretation. So 27 is trying to look at how many districts in which, hello, can I be heard?
Yes, we can hear you. Please proceed.
Yes. Question 27, how many districts in which a current line graph was available for selected priority disease? Question 18 goes ahead to say, what is the proportion of regional or provincial laboratories that have reported analyzed laboratory data to the national level? So there are a couple of laboratory data that you need to fill in. Look at question 30. This is very critical. Is the country having capacity to analyze and link data from and between surveillance systems at national and intermediate levels? So if the country does not conduct analysis and link data from and between these different surveillance systems or sectors at the national level, please select none. So we're looking at the various approaches of surveillance that are being applied in your country. Indicator-based surveillance data, event-based surveillance data, point-based surveillance data, case-based surveillance data, laboratory-based surveillance data, disaster data, environmental surveillance data, climate-related data. So is the country having a system to link all this data? That's what the question is trying to elicit. And as for the previous sessions, question 31 and 32 try to elicit the bottlenecks and then the positive factors that helps you when you are doing analysis and interpretation. Investigation and confirmation of suspected outbreaks. Has the country experienced epidemic or outbreak or any other public health emergency during 2024? So this is looking at 2024 specifically. And then carefully look at the table below. Kindly list all the epidemics or outbreaks or any other public health emergency detected, as well as the relevant dates defining milestones. So in the left column, you have the event name, and it's numbered up to 10. Probably if you have more than 10 events that occurred within the 2024, you can use a separate Excel sheet with the same listed variables and then fill in, adding the additional events. So the variables are, what is the name of the event, the date of onset of symptoms, date of detection, date of notification to the national level, date of notification to WHO, date of sample collection, date of reception at the laboratory, date of laboratory confirmation, date of initiation of national recommended public health response, date of end of outbreak, total number of cases, the total number of deaths, and then you calculate the attack rate per 100,000 inhabitants, and then the case fatality rates per each of the outbreaks that you detected. Then 35 looks at what was the proportion of reports investigated outbreaks that include analyzed case-based data. And then what was the proportion of investigated outbreaks in laboratory results, and how many epidemics have been detected at national level but were mixed by district level. So as for 38, question 38, 39, is trying to look at the bottlenecks that hampered investigation and confirmation. And 39 also looks at what help you in conducting investigation and confirming suspected outbreaks. Section 6 looks at preparing for outbreaks and other public health events. Question 40, is the national laboratory system able to test at least 5 of the 10 core tests over 80% of districts? So you select all that apply. So there's a list of diseases and the tests that you have to perform. So you select what applies to your country. Then, is there a laboratory certification and aggregation system in the country? Question 42. Does a country conduct at least one national multi-hazard emergency risk assessment, risk profiling, and resource mapping every 2 years? 43. Does a country have a functional National Public Health Emergency Operations Center, PIOC? If you have, yes or no. Then, does the country test their emergency response system and decision-making processes for efficient and effective operation once every 2 years? And then 45 looks at the emergency response coordination mechanisms and incident management system, whether the country have or not. And then 46, how many regions or province has established functional coordination mechanism? So we realize that there's a written sentence in italic stating if your country does not have regions or province subdivision, then you use the district value instead. So depending on the country, if you don't have what applies to your country. And then 47 is looking at the availability of emergency preparedness and response plans. And 48, public health risks and resource mapped. 49, if the regions or province had funds for emergency preparedness and response. And 50, looking at the contingent stocks, including laboratory supplies. 51 looks at how many regions or province labs that had performance reports of routine quality assurance. Likewise, for other sections, 52 and 53, try to elicit the bottlenecks and then the positive factors. Section 7, that is responding. 54 is trying to look at whether the country have a multidisciplinary rapid response teams, whether at the national and subnational, both, but or only at the national level.
We will wrap up just in 1 minute with this section to ensure time for the other.
So we'll proceed. And question 58, very important to know the proportion of hospitals with IPC. And we try to define the IPC below so that you use that one to answer the question. Question section on providing feedback. It gives you whether their country is producing bulletins and also the bottlenecks that you face when giving feedback. And then the capacity building and financing. This area tries to look at trainings being done, and the table below tries to elicit the expected number of people that have been trained, and then how many that you expected to train and how many you trained. And 67 trying to look at does the country have adequate skilled and competent staff for IDSR implementation? The 68 trying to look at the allocation of budgets toward the IDSR implementation. 70 and 71 looks at the bottlenecks and then the positive factors. Monitoring and supervision, that's the last section. So we try to look at, has the country reviewed the performance of IDSR and updated the system at all in the country, whether you do it quarterly, semi-annual, or annually, or is not being done at all. And then, has the country produced reports on the IDSR key performance indicator, that's the KPIs, in 2024, and they indicate whether you do it monthly, quarterly, semi-annually. Then 74 is trying to look at the supervision. So the table tries to look at the number of visits that you planned, and how many that you did at the regional level, districts, and health facilities. And 75 and 76, it tried to look at the bottlenecks that you face and then the positive factors when you are doing your monitoring and evaluation. Thank you. Over.
Thank you so much, Dr. Emmanuel, for taking us through this survey, and I'm sure everybody's eager to receive it and look through it more carefully on their own. We will now move into the question and answer session so that we can hear from you. I think this is the most important part of the virtual workshop. We would love to hear your feedback. We have received several great questions already, and I would just encourage people to continue to drop their questions into the Q&A functionality. Those that we can't get to during this session, we will type our answers in. So we have a few lined up where we will answer them live. The first one that I wanted to talk about, it's an overarching question and it's very practical. And I will pass it to Dr. Etienne to respond. So it's a question on how to scale up IDSR in countries without national funding and without financial support from WHO. This is from Raymond Bernard Palao. Thanks, Raymond, for your question. Over to you, Dr. Etienne.
Yeah, thank you very much, Sarah. I think Raymond is being very provocative here. It would not be our recommendation to scale up IDSR or do any good surveillance work without national funding. Honestly, we are actually advocating for more mobilization of domestic resources. Of course, we know the limitations and the constraints at country level, but it's something really to actually encourage. So in Africa, as you know, we have a Abuja Declaration. We know a % of a budget that should go to health. And I think we should be more advocacy to support surveillance work. Obviously, we've been struggling with this kind of situation that you're actually describing, working through the partners and so on. But it's not our best advice, really. We think we have to think of sustainability. You have seen recently what has happened after the international, the US pulled from international funding. This is something we don't want to have. And so to answer your question, really, we should continue to advocate for domestic funding, financing. And WHO, of course, does not have resources as such. We do work with partners. We've been able to interact with several projects and partners to where it's possible to really support countries. We'll continue to do that. We'll continue to motivate or encourage partners to support countries, but honestly, the sustainability part should be more important in our work. Thank you.
Thank you, Dr. Etienne. Noted, and I hope that response is helpful for all on the line. Even though it's a bit provocative, I thought it was an important theme to cover because the national ownership and sustainability piece is very central to IDSR being successful. Okay, I will move on to another question that we had directly for Dr. Emmanuel or perhaps Fleury. It was on how to ensure, specifically on the survey for 2024, how to ensure that the respondents who are also accountable for implementation don't bias their response to the questionnaire. Do you have any thoughts on this in terms of how you might adjust for that, or any advice for the survey respondents? Over to you. We don't hear you, Dr. Emmanuel.
Hello? Can you hear me?
Yes, we hear you now. Please go ahead.
Yes, if I've got the question rightly, you say that to avoid respondent bias in responding to the questionnaire.
That's correct, yeah.
Yes. Yes, it's an online response to the questionnaire, but in the question, we put in some checks so that if you are responding to a question and then the subsequent questions does not really match, it may mean that maybe you would not understand the question well, or the feedback you are doing is biased towards you want us to appreciate that you are doing well. So in that case, we'll follow up with questions to the country to specifically find out whether what is stated is true or not. That's what we'll do after we collect all the data. So we need to follow up to see specifically on the ground whether what the country is saying is what is in existence. Thank you, over.
Thank you, Emmanuel. Dr. Sadio, did you have something for that question, or it's for the following? Over to you.
Yes. Yeah, thank you. Thank you very much. I think the majority of the information that is needed for this survey, for sometimes they are publicly available. We have report from lab, we have report from district, from region, at some point at facility level. So this is not just, this survey is not just in one person who give answers. Normally, all the people that are involved into the IDSR response at country level must be together to fill the survey. And we have all those reports that can be also used to get some other information. You will see that in this survey, we have not included some of them. They are in the regional strategy, some indicators related to the JEE that countries are doing, the SPAR that countries are doing. So we will use those information also to improve. So yeah, we advise really country to give the right information on that and also to validate that one before sharing with us. Thanks, over.
Merci, Salut. I might actually keep you on the line because there's a few more questions that we could bundle together to get your thoughts. So one of them was on One Health from Justin online. You can answer in French because he's francophone. Je voudrais savoir si cette plateforme tient compte de la politique One Health. Over to you, Salut.
OK, merci beaucoup pour la question. Vous constaterez que dans les outils que Dr. Etienne a présentés, il y a une multitude de sources de données qui viennent. Donc, que la source provienne du volet animal, environnemental ou bien de la santé humaine, cela est pris en compte. Il y a notamment dans le système IIOS où on détecte beaucoup de signaux qui proviennent des autres secteurs que l'on intègre dans l'analyse pour avoir une triangulation des données. Donc, le volet One Health est bien pris en compte dans la majorité de ces outils. Merci.
Merci, Salut. J'espère que cette réponse est utile pour Justin. Merci pour la question. Okay, I think we have a few, maybe just 2 minutes for one more question. There's many great ones that were listed, but in the interest of time, I think there were many that were about how to integrate, or if you can integrate, IBS, indicator-based surveillance, with event-based surveillance. Fleury, did you want to maybe remark on how those two can work together and at what levels of the system they're being collected usually? Over to you, Fleury.
OK, merci beaucoup, Sarah. Est-ce possible de reprendre un peu la question, s'il vous plaît, parce qu'il y a eu des petits problèmes de connexion, s'il vous plaît.
Pas de souci. C'est quoi les différences entre indicator-based surveillance et event-based surveillance? Et donc, quel niveau du système ça marche mieux?
OK. Merci beaucoup. Donc, les deux sont les composants de la CIMIR. Donc, de l'IDSR, ce sont les deux principales composantes. Donc, l'indicateur IBS se fonde beaucoup plus sur la collecte des données. Les sources sont clairement identifiées. Donc, ce sont des données qu'on peut collecter au niveau des hôpitaux ou de toute autre source officielle. Alors que les event-based surveillance se base un peu sur des signaux qu'on peut avoir au-delà de ce qu'on peut trouver dans l'indicateur based surveillance. Donc, les deux sont complémentaires. Pour une meilleure mise en œuvre de la CIMIR, il faudrait vraiment combiner les deux pour qu'on puisse pouvoir détecter les événements et ne pas rater une épidémie. Donc, je pense que cette réponse a été claire et va peut-être permettre aux collègues qui l'a posé d'avoir la réponse voulue.
Merci bien, Fleury. We have a few, actually, I think we're going to extend the Q&A by a little bit so that we can have more dialogue with you all. There were also some questions on community-based surveillance, including how does this feed in to the overall IDSR strategy, and also best practices for community-based surveillance in general. We note that there's countries that are doing many great things in this area. One of the examples that Dr. Etienne had noted was Togo. I'm not sure if participants from Togo are on the line, but we know that you are doing great work in this arena, and we would love to have a forum where we could talk more about that. I actually will pass the floor to Dr. Etienne if you wanted to remark a little bit more on the community-based surveillance aspects and learnings from countries.
Absolutely, absolutely. Community-based surveillance should really be, I would say, even the front end of our IDSR work. So far, we've seen some good examples, but in many places, because of perhaps the tools and so on, it's not well integrated. But we do have examples. You mentioned Togo. Yes, Togo has actually a daily work with community workers on the ground to collect data. We have daily forms, and it's amazing what we're doing. The idea is, as we know, access to healthcare in our region is not extraordinary. Things are happening in the community. So basically, the idea is to really collect the information from the community, anything that happens at the community level, whether the community workers are there for some other things. If they see things that are happening, they can report. That's basically the intersection between event-based surveillance and community-based surveillance. And it's working in some places where they do have tools to collect the information and pass it on to the nearest facility or the nearest district. So it gets actually integrated. What we think will be the way forward is actually to bring in more digital tools, to the communities, workers, for example, to be able to actually enter the information from the community immediately when they see something. If they go for malaria drug distribution, for example, and they see that the patient has some other conditions, they can actually report very quickly through the post platforms. So it should be our focus, and I think with the work we are all doing, we should start thinking of what tools can we integrate quickly to do that. Same for the One Health approach. How can we easily report the data from the environment and so on? These are real challenges that we're facing. But it's a very important entry point. Thank you.
Thank you, Dr. Etienne. Yeah, fully agree. And I think also another country to mention, I saw several colleagues on the line from Kenya. They have a really robust community health worker reporting platform as well that's fully integrated into the national system, and it's open source. So to the extent that we can learn from these countries, and especially the open source tools to share them across borders, this is something very exciting to explore, and we hope to facilitate that. Okay, I do think we could probably take one more question. Let's see, let me have a look here. There's also one question on Is it possible to integrate AMR and healthcare-associated infection surveillance into the IDSR system to avoid fragmentation, or do these need to be separate? Does one of our panelists feel passionate about answering this question? If so, please indicate. Otherwise, I can take a stab at it.
Yeah, I mean, in terms of integration and to avoid fragmentation, it's a very good point. EMR should actually be part of the whole thing. And you mentioned the healthcare associated infections. Normally, the IDSR is intended to capture any condition, anything that is happening on the ground. So as much as the country feels that this is really should be a priority, they should actually include it. And I think some countries are actually doing it. And so I think it's to shorten the answer, AMR should be included. We want to actually avoid as much as possible all the parallel surveillance systems. Of course, because of funding, some systems are very strong and they remain, being HIV, TB, and so on. But we are still also reporting it through IDSR. And so the intention, that's what we call it, integrated disease surveillance, is to really integrate anything that is priority in the country. Back to you.
Thanks. Yeah, to the extent that we can avoid fragmentation, this is definitely what we recommend. There are some other questions we've already answered by chat. I think just the final one that I will maybe pass to the team administering the survey, perhaps Emmanuel. There's a question from Noshin Safdar on the checklists. The checklists are good, but they have their own limitations, like the qualitative perspective of the assessment. What mechanisms are in place to address these limitations? Over to you, Emmanuel or Fleury, if you have any thoughts.
Yes, I'll start and then Flora will add on. Yes, for every survey, there are limitations, but as best as possible, we should try to limit these limitations. But the idea is that when you look at the questionnaire, we try to, as much as possible, get more of quantitative questions with less qualitative questions so that we can avoid those limitations. If it comes to the qualitative questions, we urge member countries to answer as much as possible what is really on the ground, because these assessments is the benefit for your own country, so that when you feel what is exactly in the country, then when planning to improve surveillance implementation, IDS implementation in your country, they will know what you put there is the exact what is happening. So that's the only encouragement that I can give to the member states, to fill the qualitative questions as much as possible what exists on the ground. Thank you. Over.
Thank you, Dr. Emmanuel. Appreciate your patience, colleagues, as we extended that session. I think it was important to hear from you as much as we can. That's the most important part of the workshop. We will quickly pass it to Dr. Etienne just to walk us through the next steps in the closing remarks. Thanks again for your participation during this last discussion. Over to you, Dr. Etienne.
Yeah, thank you very much, Sarah. Basically, we are out of time. I just want to thank everybody for your participation in this very important webinar. This is something we want to continue to do. We want to continue to exchange with you, so we learn, we keep learning, and we keep identifying some of the gaps so that we can provide more support to you. Of course, the funding situation is difficult. We know when we started the task, and we've not been able to really continue with a lot of resource mobilization to continue the task activities. Some countries are doing it. What we recommend is really to leverage on whatever exists. There are many projects on the ground. For some countries, we have a health security partnership project. We'll have a collaborative surveillance project starting up, which will, of course, focus on some countries. Some of the countries have benefited from the pandemic fund projects for early warning surveillance. The task itself, we continue to mobilize resources for it to continue the implementation. The survey that Dr. Emmanuel presented, of course, will be important to gather even more information, more current information to help identify more gaps and address them. But overall, we're really happy to continue the discussion and continue to address the challenges that we have all recognized. We know the challenges really. Basically, through the discussion, we know now what the big challenges are. So it's more of how to go about it. Resource mobilization should be priority, and really encourage all the countries to continue to work within the ministries to advocate for more domestic funding so that we can continue to support the surveillance activities. I will stop here because we are out of time, but honestly, I want to thank you all for the great participation. We had more than 200 plus persons, at least 211, 13, which is a very good number, a very great number of participants. And so we will be in touch. We'll share the documents with you, and then we will continue to monitor the activities on the ground with you all. Thank you very much.
Bye, colleagues. Au revoir.
Okay.